Data collection for gender-based violence assessments. GBV assessments are powerful tools for advocacy and GBV programming. Let's consider several methodologies for data collection and information gathering. In collaboration with existing GBV actors, we should review prior assessments. Whenever possible, we should conduct joint assessments. Any GBV assessment should begin with analyzing information that is already available. This process is called a desk review.
This prevents asking communities the same questions repeatedly.
Precisely. We should also review information from other sources such as documents related to law and policy or on service delivery, referral pathways and standard operating procedures, aggregated and non-identifiable data from case and information management systems, and GBV client satisfaction surveys. Within the framework of an information sharing protocol, information collected by different actors could be exchanged.
Let's say we have reviewed and analyzed all existing qualitative and quantitative data. What comes next?
We would have to choose the appropriate methodology for data collection. It is always recommended to meaningfully engage communities whenever possible, particularly women and girls. In some contexts, it may be difficult to fully use participatory approaches in GBV assessments due to local cultural and gender norms, security and movement-related restrictions, difficult access to persons of concern, and the public health situation, including preventative measures. However, it may be possible to incorporate some participatory approaches into data collection activities.
We face some of these challenges. How can we address them?
When engaging with the community for a GBV assessment, you need to take into consideration key participatory principles throughout the design, implementation, and analysis processes. Consider ways you could facilitate local ownership. Actively engage with local groups, ensure meaningful engagement with the community throughout the data collection to increase accountability to the affected population. Build transparency and trust. Bring back the results of the data collection to the communities in a locally meaningful and understandable way. Community participation could be facilitated through focus group discussions, household or individual surveys, and key informant interviews.
My team has conducted multiple focus group discussions over the years, but I am not sure if we are doing these purposefully.
Let's talk about this. Focus group discussions or FGDs provide a way to debrief after mapping or observational exercises or as a standalone method to gather information about new developments. FGDs may be used to support outreach to particular groups with specific needs or that face heightened protection risks to help grasp their thoughts and opinions. We get to hear their opinions and proposals on strategies towards enhancing safety and minimizing GBV risks in their communities.
How do key informant interviews differ from focus group discussions?
Key informant interviews, or KII, is a questionnaire-based interview with a key informant. A key informant is a person who can provide information or opinions on GBV regarding a particular population based on a position of responsibility or authority, experience, and knowledge. KII provides an opportunity to introduce the object of the assessment to key informants and gain in-depth information about the situation from their perspective.
What should we consider when selecting key informants?
First, decide on which individuals would be useful to meet an interview. Then, consider who is best placed to undertake the interview. KII are usually held on a one-to-one basis. Service providers, sector coordinators, persons of concern, community leaders, women-led groups, experts, and government officials are potential key informants. Ensure due representation in terms of gender, sex, roles, and positions in the community. Do consider issues related to bias and reliability.
Thanks for this overview of methodologies for data collection and information gathering for GBV assessments. I'm ready to get started.